The purpose of this project is to explore public perceptions of mental illness, compare attendee observations, and to examine social justice implications of psychiatric treatment. One Flew Over the Cuckoo's Nest is set in a state psychiatric hospital during the early 1960s. The film follows Randall P. McMurphy, a prison inmate who is transferred to the hospital for a psychiatric evaluation after claiming to have a mental illness. Once admitted, McMurphy quickly challenges the rigid routines and authoritarian leadership of Nurse Ratched, whose strict control over the patients emphasizes obedience and conformity rather than recovery. Among the patients is Chief Bromden, a Native American man who has spent years pretending to be deaf and mute. Throughout the film, viewers gradually learn about his traumatic past, including the loss of his family, cultural identity, and personal autonomy. Although many characters assume Chief Bromden is incapable of understanding his surroundings, he is highly observant and aware of the oppressive environment around him. As McMurphy encourages the patients to reclaim their independence and self-worth, Chief Bromden begins to reconnect with others and regain his confidence. His growing relationship with McMurphy ultimately leads him to speak for the first time in years and rediscover a sense of personal agency. Following McMurphy's tragic fate after undergoing a lobotomy, Chief Bromden fulfills McMurphy's wish for freedom by escaping the hospital, symbolizing hope, resilience, and liberation from institutional oppression. Beyond its narrative, the film explores themes of mental illness, trauma, institutionalization, power, stigma, and the ethical treatment of individuals with psychiatric disorders. These themes make the film a valuable case study for examining psychological disorders, differential diagnosis, public perceptions of mental illness, and the importance of trauma-informed and culturally responsive mental health care. The movie realistically portrays the effects of trauma and institutionalization, but also reflects psychiatric practices from the 1960s rather than current standards. For example, it shows institutional trauma, highlights patient powerlessness, and demonstrates the effects of chronic trauma. But it also exaggerates some symptoms, gives ambiguous diagnoses, and depicts outdated psychiatric treatment. We will be focusing our psychological analysis on Chief Bromden. We interviewed 6 individuals who are not mental health professionals after they viewed the film. Their responses were transcribed, coded, and compared with DSM-5 TR diagnostic criteria and scholarly literature. Our goal was to understand how non-professionals perceive mental illness and compare those perceptions with professional diagnostic standards. Viewer 1, a 16-year-old female, observed that Chief Bromden was withdrawn, rarely spoke, and seemed disconnected from those around him. She identified possible concerns related to communication, anxiety, trauma, or social isolation. She believed his struggles may have been influenced by his personality and the loss of his father. She felt his outlook involved difficulty forming relationships, but that therapy and support could help improve his functioning. My interpretation of Viewer 1's feedback is that she recognized Chief Bromden's withdrawal, lack of communication, and sense of disconnection from others. Based on her observations, the possible DSM-5-TR considerations could include social communication disorder, F8.82, selective mutism, F94.0, social anxiety disorder, F40.10, depersonalization derealization disorder, F48.1, PTSD, F43.10, or unspecified mental disorder, F99. Her feedback highlights how his behaviors could be viewed as related to trauma, anxiety, communication difficulties, or feeling disconnected from reality. Viewer 2, a 14-year-old female, observed that Chief Bromden was quiet, fearful, and seemed separated from others. She identified possible symptoms related to schizophrenia, schizophreniform disorder, or social withdrawal. She believed his symptoms could have been caused by something traumatic he experienced or something he was born with. She felt that people with these struggles may have difficulty forming relationships and identified medication as one possible treatment. My interpretation of viewer two's feedback is that she identified Chief Bromden's isolation, fearfulness, and difficulty connecting with others as possible signs of a serious mental health condition. Based on her observations, the DSM-5-TR considerations include schizophreniform disorder, F20.80, schizophrenia, F20.9, schizoid personality disorder, F60.1, and language disorder, F80.2. Her feedback suggests that his behaviors could be related to difficulties with reality perception, social interaction, communication, or long-term emotional struggles. Viewer 3, a 17-year-old male, observed that Chief Bromden seemed to struggle with distinguishing reality from his perceptions, while also staying quiet and isolated from others. He identified schizophrenia as a possible diagnosis. He believed his symptoms could be related to stress and difficulty understanding his surroundings. He noted that the outlook depends on the person's treatment and support system, including medication, therapy, and positive relationships. My interpretation of Viewer 3's feedback is that he recognized Chief Bromden's difficulty distinguishing reality from his perceptions, along with his silence and social withdrawal. Based on these observations, the DSM-5-TR considerations include schizophreniform disorder, F20.81, schizophrenia, F20.9, and schizoid personality disorder, F60.1. His feedback reflects an understanding that Chief's behaviors may be connected to altered perceptions of reality, difficulty with social relationships, and ongoing psychological distress. Viewer number 4, a 69-year-old male, depicts at the beginning, Chief was inhibited, appeared depressed. He kept to himself. Throughout the movie, he showed signs of communication with McMurphy. Because of being Native American and internalizing the trauma with his father, he had inner conflicts with powerful people, and this is why he chose silence. He portrayed himself as deaf, but was more of a quiet observer until he revealed himself to McMurphy. He used his silence to isolate himself from the oppressive lifestyle of the hospital. He used this as his power to appear submissive. He concurred that he had depression as a result of his life experience and witnessing the loss of his father's identity. He describes the outcome of those with depression as optimistic. Mental illness doesn't have the negative stigma as it did during the time this movie takes place. Depression is more commonly discussed today, and treatment is more accessible. Suggested treatment is continuous counseling with a licensed therapist. Given the DSM-5-TR criteria that Chief exhibits depressed mood most of the day, nearly every day, diminished pleasure in activities, and loss of confidence or self-esteem, major depressive disorder, F33.1, is a probable diagnosis. Viewer 5, a 51-year-old female, recognized Chief as having low self-esteem, little confidence, fear, and lack of trust, encompassing depression. Because Chief had doctors, nurses, and fellow patients convinced that he was deaf and mute, she believes that he was a master manipulator as a role in his survival. Since Chief experienced severe trauma while losing his father, post-traumatic stress disorder can be a possible diagnosis, as well as depression. She considers finding a support system, such as someone who takes interest in one's life, like McMurphy did, can help build trust. Seeking new interests may contribute to building confidence and self-esteem. Treatment may include art therapy. Since Chief chose to not communicate verbally, art therapy could be a way for him to express his feelings through art while allowing personal space to speak when ready. My interpretation of these psychological symptoms and referring to the DSM-5-TR criteria, post-traumatic stress disorder, F43.10, and major depressive disorder, F33.1, can be diagnostically appropriate. Viewer number 6, a 72-year-old female, had a difficult time watching the movie because of her emotional connection. Given the sensitive nature of institutionalization and how mental illness was perceived at the time the movie takes place, the viewer chose to not engage any further. This view exemplifies how social justice is relevant with respect for patient rights and dignity. Historically specific to the year of this story, there were significant mental health changes. The Community Mental Health Act of 1963, CMHA, also known as the Community Mental Health Centers Construction Act, Mental Retardation Facilities and Construction Act, Public Law 88-864, or the Mental Retardation and Community Mental Health Centers Construction Act of 1963 was an act to provide federal funding for community mental health centers and resource facilities in the United States. This legislation was passed as part of John F. Kennedy's New Frontier. It led to considerable deinstitutionalization. Deinstitutionalization is the process of replacing long-stay psychiatric hospitals with less isolated community mental health services for those diagnosed with a mental disorder or developmental disability. In the 1950s and 1960s, it led to the closure of many psychiatric hospitals, as patients were increasingly cared for at home, in halfway houses, group homes, and clinics, in regular hospitals, or not at all. Across all 6 viewers, several common themes emerged when interpreting Chief Bromden's presentation. They identified his social withdrawal, refusal to speak, and isolation from others as some of his most noticeable behaviors. Viewers also observed signs of fearfulness, distrust, and emotional numbness, suggesting that Chief struggled to connect with those around him. Additionally, his hallucination-like experiences and difficulty distinguishing reality from his perceptions were recognized as significant concerns. Together, these observations highlight the complex psychological distress and trauma-related symptoms portrayed by his character. When we examined Chief Bromden's history, we found multiple environmental and cultural influences contributing to his presentation. Rather than viewing him only through a medical lens, we considered the significant impact of trauma, historical oppression, and institutionalization. When looking at Chief Bromden's strengths and weaknesses, it is important to recognize that he is more than his symptoms. Some of his strengths include his intelligence, ability to observe and understand others, and his capacity to form meaningful connections. Throughout the film, he shows resilience and empathy toward the people around him. He also demonstrates the ability to regain confidence and functioning when he begins to feel safe and supported. At the beginning of the film, Chief's challenges include social withdrawal, difficulty communicating, fearfulness, and distrust of others. He appears to have limited coping skills and struggles to advocate for himself. However, as the story progresses, we see his strengths emerge as he begins to reconnect with others and regain a sense of independence. The first differential diagnosis considered for Chief Bromden is a schizophrenia spectrum disorder. Supporting evidence includes his hallucination-like experiences, social isolation, and difficulty functioning independently. However, there are also factors that do not fully support this diagnosis. Chief's symptoms improve significantly throughout the film, and his experiences appear closely connected to trauma and his environment. His hallucinations often seem symbolic rather than typical psychotic symptoms, and he demonstrates more awareness and coherence than might be expected. Overall, schizophrenia is a possible consideration, but the evidence does not fully support it as the primary diagnosis. The second differential diagnosis considered for Chief Bromden is post-traumatic stress disorder, or PTSD. This diagnosis is strongly supported by his history of severe trauma, as well as symptoms including hypervigilance, emotional numbing, avoidance, and dissociation. Chief also experiences ongoing institutional trauma from the environment he is living in, which contributes to his fear and distrust of others. Overall, PTSD provides a strong explanation for many of Chief's behaviors and psychological struggles throughout the film. The third differential diagnosis considered for Chief Bromden is schizoaffective disorder. While some evidence, such as his psychotic-like symptoms and hallucination experiences, could suggest this diagnosis, there is not enough information to support it. Chief does not show clear episodes of depression or mania, which are necessary components of schizoaffective disorder. Because of the lack of significant mood symptoms, this diagnosis is largely ruled out. The fourth differential diagnosis considered for Chief Bromden is major depressive disorder. Supporting evidence includes his social withdrawal, emotional numbing, limited speech, and lack of motivation throughout much of the film. These behaviors could initially suggest depression. However, there is no clear evidence that Chief experiences a major depressive episode as defined by the DSM-5-TR. Instead, his symptoms appear to be closely tied to his history of trauma, ongoing hypervigilance, and dissociative experiences. For these reasons, major depressive disorder was considered, but PTSD provides a more complete explanation of his overall presentation. After reviewing the differential diagnoses for Chief Bromden, PTSD was identified as the most probable diagnosis. His symptoms of trauma, hypervigilance, emotional numbing, avoidance, and dissociation are strongly consistent with a trauma-related disorder. A schizophrenia spectrum disorder was considered as a possible diagnosis due to his hallucination-like experiences, isolation, and difficulty distinguishing reality from his perceptions. However, it was less supported because his symptoms improved and appeared connected to trauma. Schizoaffective disorder was dismissed because there was not enough evidence of significant mood symptoms, such as depression or mania, occurring alongside psychotic symptoms. Major depressive disorder was also considered due to Chief's social withdrawal, reduced communication, and emotional numbness. However, these symptoms are better explained by the effects of trauma and chronic institutionalization rather than a primary depressive disorder. Overall, Chief's presentation is best understood through a trauma-informed lens, with PTSD providing the strongest explanation for his symptoms. PTSD is considered the best diagnostic fit for Chief Bromden because trauma provides a stronger explanation for his symptoms than a primary psychotic disorder. His behaviors are closely connected to his traumatic experiences and the environment of the institution where he is living. As he begins to feel safer and more supported, he shows improved functioning and connection with others. Overall, the trauma-based framework better aligns with his presentation and provides a stronger DSM-5-TR fit. The social perceptions of mental illness shared by attendees revealed several important themes. Many initially associated mental illness with fear or unpredictability, showing how stigma can shape first impressions. There was also some confusion about symptoms and diagnoses, highlighting the complexity of understanding mental health conditions. However, attendees expressed increased sympathy toward individuals experiencing institutionalization and recognized the role that stigma and discrimination play. Our personal reflection is that public perceptions of mental illness can often oversimplify complex conditions. Increasing education and awareness can help reduce stigma and encourage a more compassionate understanding of mental health experiences broadly. This film highlights several important social justice issues related to mental health care. One major theme is institutional power, where patients have limited autonomy and psychiatric authority can potentially be misused. The film also demonstrates the impact of stigma, including social exclusion and negative stereotypes toward individuals with mental illness. Chief Bromden's experiences also connect to broader issues of cultural oppression and the importance of recognizing Indigenous historical experiences. His story emphasizes the need for culturally responsive mental health care that respects a person's identity and background. Overall, the film highlights the importance of trauma-informed treatment, protecting patient rights and dignity, and understanding the social and cultural factors that influence mental health. The portrayal of Chief Bromden's mental health in One Flew Over the Cuckoo's Nest has both strengths and limitations. One strength is that the film effectively illustrates the effects of trauma, institutionalization, and the impact that power and control can have on a person's mental health. It also shows the complexity of psychiatric symptoms and how they can present differently in individuals. However, some symptoms may be exaggerated for dramatic effect, and the film intentionally leaves Chief's diagnosis open to interpretation. Additionally, the treatment approaches shown in the movie reflect an older era of mental health care and differ significantly from modern, trauma-informed practices used today. The social perceptions gathered from the interviews showed several common themes regarding mental illness. Initially, Chief Bromden's behaviors were often viewed as frightening or confusing, reflecting how stigma can influence first impressions. Viewers also showed some confusion between symptoms of trauma and psychosis. However, after learning more about Chief's history and experiences, they expressed greater empathy and understanding toward his struggles. This highlights the importance of looking beyond symptoms and considering a person's background, trauma, and lived experiences when understanding mental health. This film also highlights several important social justice issues related to mental health. Chief Bromden's story raises awareness of Indigenous historical trauma, the importance of protecting patient rights, and the harmful effects of institutional abuse and stigma. His experiences demonstrate the need for trauma-informed care that recognizes a person's history, environment, and individual experiences. The film also emphasizes the importance of cultural competence and providing mental health care that respects the identity and background of each individual. Our analysis demonstrates the importance of considering the whole person, not just observable symptoms. Understanding trauma, culture, and environment leads to more accurate assessment and more compassionate care.